most people assume, or at the very least hope, that their governments are doing the right thing. But can you take this now down to the personal level and the community level, from as simple as washing hands to just other techniques people should be doing in their daily lives right now?
So the first message is wash your hands a lot, touch your face less. That's the thing that everybody can do. Now, because we're in a pandemic state, we have to think about social distancing. And that's going to be a little bit different for every person, depending on what's essential to them and what's not essential. Starting with people who are older or who have medical problems, they need to start thinking about their interactions with other people and trying to limit their risk, because that's what we're really worried about here. That's what this is all designed to help them. Because if they end up getting sick in large numbers, we will crash our whole US healthcare system, because we don't have the capacity to deal with that many sick people, such as what's going on in Italy. Other individuals who are lower risk, you have to think about what you're doing, how you can minimize your contacts without completely destroying your quality of life. You might there's some variation on what people can and can't do. Right now, we're seeing governors close bars and restaurants, and I think that's something that you're going to see more of, because there's too much social interaction going on in those types of places, and they end up being a nexus for the spread of the virus. But I do think that just being common sense, if you're going to the gym, go at times where there's not peak hours. Maybe order takeout instead of sitting in a restaurant. Maybe, and mass gatherings are basically being banned everywhere because of their risk. So that's not an issue to think about anymore. But it's that type of thing that you're going to have to do, at least for a period of 2 weeks, maybe longer, to see if we can actually blunt the curve, basically, or flatten it out, because we don't want to exceed hospital capacity. So the idea is, let's slow the rate of infection so that they're coming at a slower clip to the hospital, so that they don't get overwhelmed, because we're really nervous about that. That's the biggest linchpin in our response.
So I know that you talked about the differences that Italy has just in terms of the demographics and population, but I hear a lot of people saying, oh, we're just 2 weeks behind Italy. Do you think that that's a fair estimation?
If you look at the numbers, we have a case count around what Italy had 2 weeks before. So I think it is something that people are saying with some evidence behind it. I think we're going to start to know if we're going to follow this Italian type of model, or we're going to have more of a South Korean outbreak. But it's increasingly looking like it might be a little bit of a hybrid between them, because we were not as quick with testing mild cases and isolating them as South Korea was.
Yeah. Can you talk about flattening the curve? That seems to be the phrase that everybody's talking about. We're seeing a lot of images on Twitter.
Sure. So what we're talking about here is the epidemic curve. So think of it like a bell curve. You have a peak in cases, and then they peak and they come down. What we're trying, and you have a line here where hospital capacity is. You want to keep your curve below hospital capacity, even if it means you have the same amount of cases, but you flatten it out so you never exceed hospital capacity. So that's what we're trying to do. We know that we can't contain this virus, but can we slow the accumulation of cases to a rate that's manageable by hospitals? That's what flattening the curve is. So you don't have this big peak. You kind of have a rolling peak that's not as huge of a spike, and that's kind of the strategy being pursued by many different countries now in order to preserve our hospitals.
Where are guys like you turning for sensible information? I see online that seems to be the number one thing just for the average person, is we live in a strange time where people don't trust our institutions the way they used to. There's always a lot of noise on social media. I mean, where are you getting actual information? Where should we point people to besides, interviews like this and things like that?
So obviously if you're an infectious disease person, you kind of have your own sources that might not be suitable for people in the general public, but there are good sources. The CDC is actually a very good site. There's a lot of stuff on there that you can use that's actually vetted, and there's guidance and lots of different for all types of different scenarios that you could imagine. I think I would also make sure that people are looking at their local and state health department websites, because if something happens to them, it's going to be local. You need to know what's going on locally and what the plans are there as well. And then I would say, for science stuff, I recommend Stat News. The most Stat News is owned by the Boston Globe. It's probably the best scientific reporting in the world. That's where I look at that every day. And there's another group called CIDRAP, CIDRAP, which is at the University of Minnesota. That's the Center for Infectious Disease Research and Policy. They also put out very good news articles that are easily digestible by the public and have a lot of really great factual information there.
Hey everyone, we're obviously in some uncharted territory with coronavirus, and our plan here is to help you make as much sense of the situation in a non-alarmist fashion as possible. If you're looking for reliable information from experts on the front lines of the pandemic, check out our coronavirus playlist, which we'll keep adding updates to right over here. And to get notified of all future videos, be sure to subscribe.